My question is for Public Health Director Schuyler. We had some viewers this week reach out to us about the concern for false negatives in regards to COVID-19 testing. Is that a concern for the health department here, and have we seen any?
Well, I don't know if we've seen any because we would know they were false. But there is a false negative rate that goes along with this test, and it's close to 30%. So there is that chance that someone can be testing negative, but that is the same with every test that's out there. So that's not something that's special or unique to the COVID-19 test. That's one of the reasons why we continue to isolate people and watch their symptoms, regardless even if they have a negative test. We still are giving them advice on how to isolate and when they really should be going back to work or going back out into the community. The FDA did just approve a diagnostic at-home COVID-19 test, which some people may be hearing about. The test is very limited in use and in availability, and I was told by the State Health Department yesterday that it is not available in New York State at this time. It's made by a company called LabCorp, and it requires a doctor's order to obtain, and they really want to do, I think they're going to watch that with some more studies because of a much higher false negative rate that could accompany that take-it-home test.
And I would imagine if someone was still sick even after seeing a test come back negative, they likely maybe don't have COVID, but they have something else that still could be contagious, whether it be the flu. And do you think going forward, following this public health crisis that we've had in the pandemic, that people might be a little more watchful and a little more receptive to, I'm sick today, I'm not going into the office?
I sure hope so. I mean, I really think I think one of the silver linings that's going to come out of having a global pandemic. People are much more aware of, touching objects and touching their face and having real close contact with strangers or, massive, crowds of people. And I think we're all going to wash our hands more frequently and use hand sanitizer and be a little more cognizant of our own well-being and that of our families as we move forward. I think there's been the testing for influenza has gone down, I think, because everyone's been just worried about the COVID testing. And if you don't go in and get examined by your provider, let's say, and you have a telehealth visit, and really the question is about COVID, this time of year, we're definitely on the downswing of the influenza season. And sometimes we aren't testing then for influenza to even see if that's what the pathogen is. If we know it's not COVID, we're just going by that. We typically have an influenza season. We had a brutal influenza season this year. A lot of people were very, very ill from this. But unlike influenza, right now the preliminary research on the coronavirus is that it doesn't wax and wane like the flu does. It's not impacted by climate change I don't mean climate change, I mean change in temperature as far as someplace with a warmer climate versus someplace with a colder climate. And typically with influenza, another reason we see it so bad up north here is because people are inside, they're close together, they're sharing space. All this social distancing and these practices with respiratory hygiene that we're learning, I really think is going to help decrease the incidence of a lot of respiratory illnesses moving forward, as long as we never ever forget the lessons that we're going to learn after this pandemic.
Nationally, public health officials have warned states who are opening up now, when you open up, you might see more cases. Is that something that we could see here as we begin to lift the veil?
Oh, I would not be surprised at all if anywhere we see more cases, just because people are going to start coming together more. There's going to be more close contact. There's just raises the risk. If you're looking at an infection that's spread by droplets, you've got to be close to one another to get that, and the risk of that goes up. So everyone pretty much is expecting to see higher numbers moving forward. But that's why public health is here, to have that test done, to identify those cases and to isolate them, do the contact tracing, and keep that from spreading into an actual outbreak.